So for those of you who don't know what your tear troughs are, it's this groove which comes down from the inner part of your eye down to your mid-cheek. And quite often some people will have quite a bit of hollowing in this area, and it gives the appearance of quite tired and fatigued eyes. And so what we can do is actually layer dermal filler into this area. Now, to answer the question of complications, to be quite honest with you, it's probably the area of the face in which I see the most complications. And it comes down to a few things. So when we inject dermal filler into this part of the face, there's some delicate structures under here, like your lacrimal glands, that cause your tears, and you have this big, huge, round muscle that surrounds your eye called your orbicularis oculi muscle, and when it contracts, it's what causes your eye to close, essentially. So when we put dermal filler into this area, it has to go beneath the muscle and above the bone, or the periosteum, which is layer above the bone, which covers your bone. And so the issue isn't necessarily to do with migration, although a lot of the time it is. In my opinion, the main issue is actually comes down to placement when you initially get your troughs done, and that comes down to the injector essentially. So the tear trough, what we often use is a cannula, which is this thing here. And why we use a cannula? Because it's long, but the most important thing is because it's blunt. So as you can see here, it's not like a needle which is sharp. And the reason why we use it is we make a small entry point here, just the lateral aspect of your cheek, and then we thread the cannula up underneath the groove of your tear trough. Now, the depth of where this cannula sits is the most important thing. When the cannula goes in, it has to go beneath the muscle. And what I often see is when injectors actually don't put the cannula deep enough, and the cannula sits either in the muscle or even above the muscle and underneath the skin. Now that can cause quite a few issues. So when that happens, the filler can migrate superficially towards the skin, it can migrate downwards, or it can even migrate upwards. So the injection depth is really important. And what I often see in terms of complications is when the filler is simply too superficial. And when that happens, what you can often very clearly see the filler underneath your eyes and your tear trough. It often looks like big bananas or slugs, to be honest. Other effects you get when it's too superficial, if the tear trough sits just under the skin and it's too superficial, you get what's called a Tyndall effect. Now what that is when light sort of goes through the skin and refracts off the filler underneath the skin, and it causes this blue tinge. It's not quite the tinge you see when you have a bruise, but it is noticeable. So those two things are the main complications that you can get. Other things to note is that not everyone is a candidate for dermal filler. Okay, so if you have hollowing under your eyes, but if you have, say, bags under your eyes at the same time, you're most likely not a candidate for dermal filler. The filler itself is hydrophilic, which means it attracts water. And if you have bags under your eyes with the hollowing, then quite often adding filler there can actually make the issue a lot worse. There's other things to consider, like the skin under your eyes. If you have a lot of excess skin, then adding dermal filler there more than likely isn't going to help much. You're probably more of a candidate for something like blepharoplasty, which is a surgical procedure where we remove the excess skin under your eyes. So there's lots of things to consider when you're getting dermal filler in this area. What I would do is find somebody who has a lot of experience in it, and somebody who knows what they're doing, and somebody who knows a lot of the anatomy around your eyes, because of all the procedures that you can have, this is an area where you really do need to have an in-depth understanding of the anatomy around that area. The last thing I would say is that if you're having tear troughs done, there is only one product on the market that is licensed for tear troughs, and that is called Teoxane Redensity 2. Now I think that's quite important because I have seen a lot of patients have dermal filler put in their tear troughs which is not Teoxane Redensity 2, and the results are nowhere near the same as what you would when you use that product. So if you're having your tear troughs done, make sure it is the right product. There is only one that's licensed, and make sure that you find the right practitioner who has experience and who has a lot of knowledge about the anatomy around that area.